But welcome, everybody. We're thrilled to have you here. We're going to get started. And before we get into the content of the presentation, just two quick notes of housekeeping. One, this session is being recorded. So we will share this afterwards with a whole bunch of links and resources for you to review. So bear that in mind, because we know there's a lot of information here. And two, we know folks may have some questions. We encourage you to submit those via the Q&A button versus the chat. It helps us track it better and make sure that all your questions are being answered. So I am seeing all the comments come through, and we definitely have a wide group of people from all across the country, which is really, really exciting. And with that, I want to introduce two people. Rebecca Kinney, who is Director for the Office of Healthcare Information and Counseling from the Administration for Community Living, is with us. She'll be joining us later today to provide some really clear expertise about what ACL is doing to help support employers around Medicare and the resources available to you. And I'm also joined by my colleague and friend, Tricia San Diego, Senior Advisor on the Caregiving and Health team from AARP, who's going to be presenting today and providing the main content about what you can do. Well, with Tricia, with that, I think I've given enough introduction, talked enough here, so it's my pleasure to pass the microphone over to you, and we can get started on today's presentation.
Thanks so much. And I'm seeing the chat still rolling through. Thanks for everyone for introducing yourselves and letting us know where you're calling in from. And appreciate your time today. And I'm glad that you could join us. And welcome to Rebecca as well, who will be presenting a little bit about their program. I hope everyone's having a good start of the summer so far. This is a topic that, regardless of the season, is important, particularly for employees, for individuals and their loved ones who are approaching Medicare eligibility or who are currently already enrolled in Medicare or are at a crossroads at their health care coverage decision and are looking for more information about that and how to help others or, help yourself, even if this is what you're here for. Our agenda today is really to cover the Medicare basics. Medicare can be complex, but at the same time, there's ways to kind of make it more digestible so that it's easier to understand and not so overwhelming. We recognize that sometimes there's a lot of details and information to digest, and it can be a lot. But today, we'll cover the basics so you have a really good, firm foundation of the knowledge on sort of the basics of Medicare. Then we're going to talk about what your role can be when it comes to educating your employees on Medicare. Is it going to be a big lift? Are we requiring you to, become subject matter experts on Medicare? No, not necessarily. I think there is a small role that you can play that can actually reap a lot in terms of benefits and assistance for your staff. And then we're going to go talk about resources and tools that you can use to refer people to, that you can use for your own healthcare coverage situation. And there's a plethora of resources out there. So it's trying to kind of cull through all that's available to you and sort of what is the credible, non-biased sources of information that are trustworthy that you can turn to. I'd love for you all in the chat, we're going to cover some of these common questions, but I would love for you all in the chat to let me know, why are you here today? What are you hoping to learn and accomplish? Are you here for your own personal coverage or a loved one? If you're a caregiver, a family caregiver, AARP is very much interested in helping family caregivers. Are you here on behalf of your employees? Are you a small business owner or in the HR benefits world and you want to know what role you can play? I'd love to hear sort of the common questions that you are getting. This is some of the ones that we've already heard from this audience. We've heard some of the basic questions. What is Medicare? What is covered? We've heard questions like, when should I enroll in Medicare? And what happens if I don't? And then questions around, how will Medicare work with my existing healthcare? That healthcare coverage coordination aspect, particularly in the workplace setting, for those who may still be covered by their employer coverage, there's a lot to sort of disentangle there. And so these are some of the questions that we get, and I hope to address them. And as Colin mentioned earlier, if you do have questions, specifically that you would want to try to be answered by the end of the session, feel free to go in the Q&A icon on the bottom of your screen. So let's talk about your role as a business owner. I mentioned on the next slide the things that we are hoping to encourage you to do. These aren't necessarily requirements. These aren't things that you have to do. These are the right things to do. They're nice things to do, and they would, again, really help your staff, your loved ones, yourself, avoid things like coverage gaps and financial penalties that can be, debilitating. So your role as a business owner is to provide Medicare eligible employees with educational materials about Medicare. And we want you to connect employees with unbiased sources of information and to help Medicare eligible employees avoid enrollment penalties. These are things that you can do, and hopefully it's actually not going to be a big lift. We'll point you to all the resources that you can point individuals to and refer people to. It gets tricky, providing specific advice or counseling around Medicare because you don't want to lead someone to make the wrong decision. What you want to do is help people consider factors that they may not have thought of and make sure that they know all their options so that they can make the most informed decision for themselves. So there is that sort of fine line. We're not asking you to sort of prescribe a plan that would be, best for your staff, because again, you don't want to lead them in the wrong direction, and it may end up having negative repercussions unless you're very confident in your knowledge. But there's plenty of people and resources to turn to where they can get that. I think your role is going to be sort of the reminder function to prevent people missing deadlines, and then that referral function as well. So next slide. I mentioned we're going to cover the basics. So let's start at the very beginning. What is Medicare? The brief definition of Medicare is that Medicare is a federal health insurance program for people who are age 65 and over, for some younger people with certain disabilities, and for people with permanent disabilities like end-stage renal disease and people with ALS, also known as Lou Gehrig's disease. Next slide. I mentioned a little bit about the employer responsibility, and then financially, these are the terms that cover the employee responsibility. Like most other insurance, Medicare does not pay for all of your healthcare costs. People are responsible for paying for the costs that are not covered, such as monthly premiums, deductibles, co-insurance, or co-payments. So you may already be familiar with these terms based on existing health coverage that you have or your knowledge of sort of the health insurance space, but let's briefly define them. A premium is the monthly amount an individual would pay to Medicare or a private insurance plan for an individual's healthcare and prescription drug coverage. A deductible is the amount an individual would owe for healthcare services that the health plan covers before your health plan begins to pay. The deductible may not apply to all services. Co-insurance is the amount an individual may be required to pay as a share of the cost for services after they pay any deductibles. And co-insurance is usually expressed as a percentage, something along the lines of the patient responsibility is 20% and the health insurance plan or Medicare will pay roughly 80%. Co-payment is the fixed amount an individual would pay for a covered healthcare service, usually when they receive the service, so sort of at the point of transaction or at the point of the service. When you're leaving your doctor's office, for example, or a lab test, you may pay for the co-payment there or ask to be billed later. The amount can vary by the type of covered healthcare service and the type of plan that you have. Next slide. Let's go over what Medicare does not cover. It does not pay for vision, dental care in most cases, hearing, or long-term care, such as an extended stay in a nursing home. Medicare Advantage plans, which we'll talk about later, may cover these, but traditional or original Medicare does not. We will get into the differences between original Medicare and Medicare Advantage shortly. The fact that Medicare does not cover long-term care services is a surprise to a lot of people. Medicare only helps cover certain services if they are medically necessary, and it does not cover what we call custodial care. That's help with activities of daily living. Those activities of daily living are going to be things like bathing, eating, dressing, and using the toilet. Next slide. Let's go on to the different parts of Medicare. It can become a bit of alphabet soup very quickly. And so you'll know why, because there's parts A, B, C, D, and we'll break it all down. So we're starting here with Part A. Part A is hospital insurance. It's going to help cover inpatient hospital care, some home health, hospice, and some skilled nursing facility care. Let's go over the costs in 2023 for Part A. These are the out-of-pocket costs for individuals. Most people who qualify for Medicare actually don't pay a premium for Part A because they already sort of prepaid for it through their payroll taxes while they were working. If you do not have premium-free Part A, you may be able to buy it under certain circumstances. Part A does have coinsurance in addition to a deductible. For 2023, the deductible is $1,600. This is going to be for days 1 through 60 of inpatient costs during that benefit period. The benefit period ends when you haven't gotten any inpatient hospital care or skilled care in a skilled nursing facility for 60 days in a row. If you go into a hospital or skilled nursing facility after one benefit period has ended, a new benefit period begins. So that's Part A, hospital insurance. Let's go to Part B. Part B covers medical insurance. It's going to cover a portion of the costs of doctor visits. It covers outpatient hospital services, durable medical equipment. This is going to be things like wheelchairs, walkers, hospital beds, for example, rehabilitation therapy, laboratory tests, x-rays, some mental health services, and some preventive services to help maintain your health and detect problems early when they are at a more treatable stage. So Part B is medical, and we'll go over the costs now. The costs for 2023 for Part B, the premiums are $164.90 per month for those who are enrolling in 2023. Premiums go up for those with higher incomes. Individuals earning more than $97,000 a year, or couples earning more than $194,000 a year. Those folks will pay premiums based on their income. It's called an income-related adjusted amount that's sort of tacked on to that monthly premium. So those with higher incomes do pay higher costs for Medicare Part B medical insurance. The annual deductible for Part B in 2023 is $226, and the coinsurance in most cases is roughly 20%. Next slide. We're going to go to Part C, which is Medicare Advantage. And Part C isn't really sort of a subpart to Medicare. It's actually an alternative option to getting your Medicare coverage. It's alternative to what we called original Medicare. So original Medicare is going to be like your Parts A and B, and then some will buy a Part D plan, which we'll talk about. Part C is a whole other option. As I mentioned earlier, Medicare Advantage plans also may be known as Medicare Part C, and Advantage plans are private health plans offered as an alternative to original Medicare. They are provided by Medicare-approved private insurance companies. All Medicare Advantage plans must include Parts A and Part B. And in most cases, they will include prescription drug coverage, which is called Medicare Part D. Next slide. How does Medicare Advantage work? Medicare Advantage, also known as Part C, these plans are available in most parts of the US, but you must live in the plans area to receive services. You must choose from the plans available in your area and sign up directly. Medicare Advantage plans pay for the same healthcare services as original Medicare, but they might also pay for additional healthcare services, such as vision, hearing, and dental. Those were the services that I mentioned that in general, original Medicare does not cover. In most Medicare Advantage plans, you can only go to doctors, specialists, and hospitals in the plan's provider list in their network. Plans may limit coverage or provide no coverage for out-of-network providers. You also have to follow the insurance company's rules, such as requiring a referral before you see a specialist. So make sure you understand how Medicare Advantage plans work before you join. There's going to be trade-offs. On the one hand, you might have some additional benefits and services like vision, dental, hearing that is not covered by original Medicare. However, there are some rules and some limitations potentially when it comes to the provider list, the service area that offers the plans, as well as things like, are you going to require a referral? Are there more costs if you go out of network and that kind of thing? Next slide. We're going to go to prescription drug coverage. And I think this letter is probably the easiest one for me to remember. Part D. D stands for drugs, prescription drug coverage. Medicare Part D helps cover some of the costs of prescription drugs that an individual picks up at the pharmacy. Part D plans are run by Medicare-approved private insurance companies. To get Medicare prescription drug coverage, you must join a plan run by an insurance company approved by Medicare. If an individual is eligible to join, but they do not, there actually could be a late enrollment penalty. So this is one of those things where you need to think about timing. Medicare Part D is provided by standalone Medicare prescription drug plans, plans that offer only drug coverage. And they're also provided by Medicare Advantage plans. They often offer coverage for both prescription drugs and healthcare. Let's go over the costs. For Medicare Part D, the 2023 costs, well, the benefits and costs are going to vary among the different plans. There is typically a monthly premium, deductibles, co-payments associated with Part D, unless you qualify for assistance paying for these costs. As with Part B, premiums with Part D are higher for individuals earning more than $97,000 a year, or for couples earning more than $194,000 a year. For 2023, the standard benefit for Medicare Part D includes a $505 deductible. After meeting the deductible, you are responsible for 25% of your covered Part D prescription drug costs until your total spending reaches the initial coverage limit, which in 2023 is $4,660. Okay, so we went through the main parts of Medicare, and I said it was a bit of an alphabet soup. As a quick reminder, A is hospital insurance, B is medical, C is Advantage, which is a separate pathway of getting your Medicare coverage, and then Part D, D stands for drugs, prescription drug coverage. But let's talk about those different pathways. We mentioned that there's two main options for how you can get your Medicare health coverage. There's original Medicare, which sometimes is referred to as traditional Medicare. If you have original Medicare, Parts A and B, and you want prescription drug coverage, you must also join a Medicare prescription drug plan. You have to actively sort of shop around and choose for a Part D plan. If you don't join Part D initially and you don't have drug coverage, but then you want to join later, you could incur a fee. Medicare Advantage is the other option, and it's also known as Medicare Part C. These Medicare plans are offered by private insurance companies, and they typically do cover Parts A and B and D all under one plan. And then I mentioned sometimes these Advantage plans also have other extras like vision, like dental, Sometimes there's things like meal planning or gym discounts. So there's other little perks that you sometimes can get with Medicare Advantage. So let's go a little bit deeper on these two options. Original Medicare is one way to get it. Your Medicare, it's a fee-for-service health plan. Original Medicare consists of both Parts A and B and covers many, but not all of your healthcare costs. In general, it translates to about 80% of your covered medical costs after you pay your Part B deductible. Because Medicare does not cover all your healthcare costs, some people consider buying a Medigap policy. And that's another term to get to know, and we'll talk about that. It's a supplemental plan. It's sort of a wraparound plan that you purchase in addition to original Medicare. You can only get a Medigap policy if you have original Medicare, and we'll discuss this in a few moments. People with original Medicare can go to any doctor, hospital, or other health provider who accepts Medicare, which includes about 95% of physicians. Now, there's some physicians who, if you're switching doctors and you first join original Medicare, yeah, there might be doctors who accept original Medicare, but not all doctors are always accepting new patients. So that's another thing to kind of keep in mind when you're shopping around and if you are, thinking about switching providers. If you have original Medicare and you want to get Medicare prescription drug coverage, you must choose and join a Medicare Part D prescription drug plan. All right, let's go to enrollment timeframes. When do employees, individuals enroll in Medicare? I think there's many different terms and timelines, and so we're kind of going to go over all of those. It's unclear for people to know sometimes when they're supposed to sign up. And then if employees do not sign up for Medicare during the appropriate window, they may incur a penalty. Let's talk about these three different enrollment periods. We have the initial enrollment period, special enrollment period, and open enrollment period. Initial enrollment. This is for individuals who are enrolling in Medicare for the first time, so not those who are already Medicare beneficiaries. If individuals are already receiving Social Security at the age of 65, your Social Security benefits, if you already started claiming those benefits, let's say at the age of 62, and by the time you turn 65, you are collecting Social Security, these individuals will be automatically enrolled in both Parts A and B. Employees who will enroll during a 7-month period based on their birth month, that's the 3 months before their 65th birthday month, the month of their 65th birthday, and then the 3 months after their 65th birthday. If they don't enroll in Parts B and D when you are eligible, they may face financial penalties later when they do enroll. Employees with coverage through an employer or spouse's employer plan are exempt from any penalties for the most part. So that's initial enrollment. Enrolling in Medicare for the first time, automatic if you're already collecting Social Security benefits by the age of 65. If not, you have a 7-month window to enroll that centers around the month of your 65th birthday. If you are continuing to work and you have employer-based coverage through your spouse, you may decide to sort of delay that initial enrollment, and then you will then be eligible for what we call this special enrollment period. If an employee does not enroll during initial enrollment for an exempt reason, they will be able to enroll in Medicare during special enrollment. Employees who lose employer-based coverage, for example, if they retire, they have 8 months from losing coverage to enroll in Medicare without a penalty. After 8 months, these employees may face a penalty. Employees who missed initial enrollment for no exempt reason, such as having employer-based coverage, can enroll in a general enrollment period. And general enrollment is at the start of each calendar year. However, employees will most likely incur a penalty when enrolling during general enrollment. So this is why it's really important that you can play this role, this sort of reminder function to kind of nudge employees to think about the timing of their enrollment and to make decisions around their healthcare coverage because of the fact that there may be coverage gaps as well as penalties. So we have initial enrollment, we have this special enrollment, which is a period for those employees who decided to delay initial enrollment for an exempt reason being they have employer-based coverage. And then if you miss your special enrollment period and your initial enrollment period, and you should have enrolled in Medicare, it's not the end of the world. You still have a general enrollment period where you can enroll. However, you have to realize that you may incur a penalty, a financial penalty. Let's talk about another enrollment period. This is called open enrollment period. And open enrollment is similar to, HR. Your HR department might have open enrollment for your employer-based plans every year, usually in the fall. Well, Medicare sort of has that same period as well. It's an annual period that happens from October 15th through December 7th. And this is for existing Medicare enrollees. They can change coverage and adjust during this open enrollment period. It's not for people who are enrolling in Medicare for the first time, unless your birth month happens to fall during October 15th through December 7th. Open enrollment is generally for existing Medicare beneficiaries. And what can you do during open enrollment? You can switch Medicare Advantage plans. You can join, switch, or drop a Medicare Part D plan. Medicare eligible employees are not allowed to join during open enrollment. This isn't your initial enrollment period necessarily. Next slide. Let's go over the penalties. There are different penalties based on the different parts of Medicare. This is where you can play that crucial role to help prevent these penalties from being incurred. You can help employees avoid late Medicare enrollment penalties by helping remind or nudge when it's their time to enroll. Listed here are the penalties for each part. There are no late enrollment penalties associated with Part C because it is voluntary. I want to call your attention to Part B in particular. This penalty, which is 10% increase for monthly premiums for each 12-month period not signed up. That penalty will stick with you for as long as you have Medicare Part B coverage. So that can be locked in for many people for the remainder of your life. You're paying this extra amount. These penalties can have a dramatic impact on one's healthcare, which is why employers need to be thoughtful of the way they educate and engage their employees on it. Part B is probably the most substantial of the penalties here, but you'll also see Part A has a penalty. There's an up to 10% increase for monthly premiums for twice the number of years not signed up. For Part D, you would multiply 1% times the national base beneficiary premium. That's a lot to kind of say and refer to sort of the average cost, the monthly cost of a premium in a year. So you would multiply that 1% of that premium times the number of full uncovered months you didn't have Part D or creditable coverage, and you should have. So all of these can add up. And as we know, healthcare costs tend to increase every year that you age, the older that you get. And so every little amount that you can save or prevent is really going to make a big dramatic impact. We'll go on to the next slide. Talking about Medicare and your business. So I'm hoping we covered the basics and that you have a better understanding of what that is. I'm going to dig a little bit deeper into sort of Medicare employer requirements. So one thing that's important to note is that employer size determines Medicare requirements. For large employers, the work-based coverage is the primary payer, with Medicare providing secondary coverage. For small employers, this is going to be the opposite. And you'll see the definition. It's based on 20, the number 20. Fewer than 20 employees, that's considered small. These eligible employees must enroll in Medicare. Medicare becomes the primary insurance, and any work-based coverage that a small employer may still offer becomes secondary. that secondary coverage won't pay anything until Medicare pays first. So that individual needs to be enrolled in Medicare and have Medicare as their primary coverage before the secondary coverage that's offered through the employer, if any, kicks in. For the large employers, which is going to be more than 20 employees, eligible employees can choose to enroll in Medicare if they would like, or they can stay on the work-based coverage. So this is where there's this option to delay initial enrollment and use a special enrollment period later when they decide, that they will no longer have their employer-based coverage. For example, if they're retiring or if they lose their job. In large employers, Medicare is the secondary insurance. If they enrolled in Medicare, Medicare is the secondary insurance and the work-based coverage is primary. So this is where that sort of coordination of benefits thing, these are sort of the basic tenets to kind of understand with how that works. Let's dig deeper into common scenarios. For the small employers as well as large employers, since Medicare is the primary payer for small employers and failure to enroll may result in uncovered medical expenses, the vast majority of employees will enroll in parts A and B during initial enrollment. For large employers, these three scenarios are the most likely to occur. And there's a lot of variation, but there's different choices that people have, and you generally have more choices or options if you're working for a large employer. Scenario one is that you can enroll in parts A and B during your initial enrollment period. At that point, when you enroll, you're going to be starting to pay for those premiums for Medicare. Scenario two is that you enroll in Part A only during initial enrollment, because for most people, Part A is already prepaid, as I mentioned, and so it's considered kind of premium free in many ways. Some people will enroll in Part A only during initial enrollment, and then they'll delay Part B. And this is assuming the employee is still covered by an employer plan until enrollment during a special enrollment period. The other scenario is that people will delay both Medicare Parts A and B altogether until enrollment during a special enrollment period. So those are the different options that employees have for large employers, those with more than 20 employees. So let's talk about sort of timeline around education and communication. We recommend that you plan to send out a total of 4 communications to your employees in advance of their 65th birthday. So maybe using their birth date, their date of birth, as that sort of trigger date, and then backtracking from there, starting at 6 months prior. The first communication should be a general primer about 6 months in advance of their birth month. This is just sort of an introduction to Medicare or some basics. Be sure to discuss basics of Medicare and what they should expect during initial enrollment. As soon as their initial enrollment period opens, which is the 3 months before the month of their 65th birthday, this might be a good time to send a second communication. Things with more educational materials and resources and resource links. And this could include resources from third-party organizations, such as CMS or AARP. During their birthday month, this is the month of their 65th birthday, be sure to share a list of unbiased sources of information and guidance. There are many brokers who spend a lot of time, trying to get and take on and sell to new Medicare enrollees. And they have varying experience, and you may not be sure if they're completely unbiased. And so you do have to kind of be careful about who you refer people to, make sure that they're credible, unbiased, trustworthy sources of information. Finally, a month before initial enrollment closes, you can reshare all these materials with them and then include a final letter, just sort of one last final reminder that they have a month left before they may miss their enrollment deadline if they're required to join Medicare, and they may start receiving penalties, financial penalties, when they do decide to enroll, or they may experience coverage gaps, and that could be something that's very dramatic, has a dramatic impact on their financial security. So as an employer, it's the nice thing to do, it's the right thing to do, to have this responsibility to educate your employees during this transition, because of the long-term impacts and penalties and coverage gaps that an employee, an individual may face that can have these lasting impacts. And it can be confusing and frustrating to many. So just providing this extra clarification about what they need to do. If you are a smaller employer and they have to enroll in initial enrollment, this might be a good time to sort of nudge about that. Or if not, and they have options, let them know their options, because many people don't understand and realize all the different scenarios that can play out depending on their options. And they're going to be the ones who ultimately decide what they choose with their healthcare coverage decision. But let's equip them with as much knowledge as they need to make the most informed decision. Okay, so next slide, just to reiterate. You want to engage your employees on Medicare with clear and consistent communication. Talk about this transition time period and the information that they need, the deadlines that they need to know. Only refer employees to trusted sources of information. As you mentioned briefly, brokers, other stakeholders, other private insurance company plans, they're going to compete and get the attention of many Medicare eligible people. We see during open enrollment season, those who are already existing Medicare beneficiaries, they get bombarded by ads, by phone calls, telemarketers, mail. And so it is a lot to kind of sift through and try to understand. So try to help protect employees from these, threats in some ways, but also just being overwhelmed by too much information and not really being sure where to point to, and connect them to unbiased sources of information. Before employees turn 65, educate them about the program, what the transition could look like. Employers should talk about Medicare during annual review times with employees, or during company-wide educational sessions on healthcare. Maybe it's already an existing open enrollment season within a company organization. That's a great time to also talk about Medicare coverage. Be primarily an open resource for employees when they have questions to help them navigate the transition. But as I mentioned, you don't need to be the one sort of prescribing their solution for them and telling them what to do. You want to equip them with the factors that they need to consider based on their own lifestyle and their choices that would help them make the most informed decision. So it's really reminding them of certain timelines and deadlines that may impact them so that they can avoid penalties and coverage gaps. And then it's equipping them with the resources and information they need to make the best decision for themselves, referring them to those resources and counseling. So let's talk about those resources here in this next session. And there may be other resources that you can think of. These are the ones that I would say are the biggest and I find the most helpful in terms of not being overwhelming and helping people sort of get to their answers to their questions as soon as possible. First off is Medicare.gov. The Centers for Medicare and Medicaid Services, they are the ones who are the main points of contact for Medicare. And their website is Medicare.gov. This is the official US government site for Medicare. There's also a main phone number for Medicare. That's 800-633-4227. And we'll talk about, if you're just trying to learn sort of basic information about Medicare, Medicare.gov is a great place to start. And then if you're more thinking about questions about choices, there's more information that you can get from sort of personal one-on-one individual counseling through the SHIP program. And we'll talk about that next. Before we go there, the next slide, we have a couple other organizations that the AARP thinks are a trustworthy third-party source of information. The Medicare Rights Center is a nonprofit, and they are available at MedicareRights.org. Their phone number, 800-333-4114. And then the SHIPs, the State Health Insurance Assistance Program, I briefly talked about them. If you're looking for more help on, counseling and Medicare Choices, the SHIP is a great place. And that is where we have Rebecca Kinney joining us from. And Rebecca, thank you so much for joining.
Yes,
Take
thanks,
it
Tricia.
away.
Thank you. Thank you. Thanks, everybody, for joining us today. So I'm going to share a little bit about my organization and the programs that we oversee. So to start, the Administration for Community Living, we are an operating division under the Department of Health and Human Services. And our mission is really to serve older adults and persons with disabilities across the lifespan. So we house quite a few programs, initiatives, services that provide services to those target populations. And our mission is really to maximize the independence, well-being, and health of older adults and people with disabilities across the lifespan. We also provide services to their families and caregivers. My particular set of programs are focused on Medicare eligible beneficiaries and their families and caregivers. I'm sorry, my dog has decided this is the time to bring me a squeaky toy. I have to take it away from him. The joys of working from home. Okay, so ACL, let's go to the next slide and we'll talk about SHIP specifically. So as I indicated, the programs that I oversee are focused on Medicare individuals, and the largest of those programs is our State Health Insurance Assistance Program. This is a national program. We have grantees in every state, DC, Puerto Rico, Guam, and the US Virgin Islands. We have a network of over 2,200 local programs and organizations that have over 12,000 counselors. And what the SHIP does is really helps people navigate their Medicare and understand their benefits. We provide a lot of one-on-one assistance. So if somebody has questions about Medicare eligibility, enrollment, what services are covered by Medicare, our counselors can help them really understand that and sort through those different options. Annually, we serve about 2.5 million one-on-one in those individual sessions, really diving into a unique situation and helping them navigate their options. We also serve an additional 4 million people through public outreach events. So we often go into the community and provide presentations similar to what we're doing here today. It's an overview of how Medicare works or a particular set of benefits to the public to give them that information. And then oftentimes we end up with a lot of one-on-one counseling sessions after those public outreach events. And, as I said, we really help people understand their choices. We help them with enrollment, and we also do a lot of assistance for those with limited income and assets. And we help them enroll in programs to help them pay for their Medicare. The Medicare savings programs, which help pay their Medicare premiums and co-pays, or the low income subsidy or extra help, which helps with the prescription drug coverage, helps pay the premiums and co-pays on that. Next slide. The SHIPS, as I said, is a national program. If you go to shiphelp.org, you'll find our locator, which is highlighted on the screen here. I strongly encourage you, particularly if you have somebody who has a complicated situation and not really sure how to answer the details of that Medicare situation for that individual, the SHIPS are a great resource to go to and get assistance on that. They also would be a great resource, depending on the desire, to do an outreach event or an educational session for a larger group of people, and really just, as I said earlier, give an overview of how Medicare works. This is particularly helpful during open enrollment or leading up to open enrollment, when everybody who has Medicare is really looking at what choices do I have for this next year, what's available and what looks like it would be best for me. And I believe with that, I'm going to hand it back over to Tricia.
Thanks, Rebecca. You have a squeaky toy and I have an alarm that is going off for some reason on my phone. So yes, the joys of working from home. The SHIP is such a great resource, as well as ACL. We're very excited to be collaborating with you on that. As Rebecca offered, she does these educational sessions. We at AARP do that as well in various formats. First and foremost are these types of live virtual program events like today's event. We do them for employers like yourselves, but then also if you're interested in offering this very session, but have the employees version of it, the consumer side of things, we're happy to work with you to offer this type of session to your own staff. A few of you mentioned some of them. some of your employees, you're aware, are approaching eligibility, have some questions. And if you want them to sort of have this knowledge of Medicare basics and some fundamental resources that they can turn to, we're happy to provide that. Just drop a message in the chat and we'll be able to work with you and hopefully collaborate with Rebecca and the SHIPs on delivering some of these educational sessions. I want to turn your attention to aarp.org/Medicare. That was the website prior. That is going to have tons of articles and content and information about Medicare and so many different subtopics within Medicare. This tool right now that you see on your screen, aarp.org/learn-Medicare, I find this is going to be the most easy way to kind of navigate initial enrollment. It is our fairly new tool that we launched, I think, over a year ago only, and it is a step-by-step resource guide that has a little bit of customization in that it's kind of like choose your own adventure. You are kind of inputting things, but not overly, personal, confidential, private information. But as you click through the tool, you are kind of telling us a little bit about your situation. And then at the end, it will sort of spit out a report that kind of tells you the main things to consider. So as we were talking about, a great resource to point your employees to, I do encourage you to go to our Medicare Enrollment Guide tool, and that's available at aarp.org/learn-Medicare. Next slide. We have other ongoing employer webinars like this one. You can find a lot of other ones available at aarp.org/Medicare employer. Oftentimes we'll do consumer webinars as well that you'll find on here. They will be recorded and live, but if people want to view it on demand, this is a great activity to sort of maybe replay one of the topics that we already did this year and maybe make a lunch and learn session out of it and offer that to your employees. Or I see some people interested in our workshops. Feel free to reach out to us and we can work with you to schedule a Medicare 101 session for your staff. Next slide. So in conclusion, I think we have just a few minutes left over for Q&A and we will get to that. We covered the basics of Medicare and I hope it wasn't too elementary nor too complex for you. We were trying to just strike that right balance because we know that people are at all different, areas of expertise, and Medicare quickly can become complex, but if we kind of break it down into chunks and pieces, I think it does become more digestible and understandable. And the more people know about Medicare, the better decisions they can make for themselves and for their loved ones. We equipped you with some tips on how you can educate your employees on Medicare. Again, I hope it's not a heavy lift. We're really focusing on your function as a reminder and as well as a referral. So sort of 2 R's to remember there. And then the other R is resources, tons of tools and resources from nonprofit, government, as well as AARP, also nonprofit. This is all part of our social mission side, and we are happy to help you as you are educating others as well as yourself on these important topics. Before we go to Q&A, may I ask a quick favor? If you have a few minutes of your time, just I think the next slide is going to be our quick survey questions. It's going to appear on your screen. 3 quick questions. Let us know how we did today. What can we do to help you? Feel free to drop other comments in the chat if you'd like. But we want to know if this is helpful to you for yourself as you, in your role in your current profession, or if you think this is going to be helpful to you as you educate others as well. So appreciate your time and thank you for filling that out for us because we are constantly looking to improve. And now with maybe about 10 minutes left in the session, I'll tag team with Colin here and Rebecca for any questions.
Well, I will just say, Tricia and Rebecca, thank you both for your comments. You guys did a fantastic job kind of wading through all this information because it's a lot. And I know we're letting the poll questions kind of just percolate for just a little bit more time as folks are being able to do so. And we're getting a few questions going in. One, just a basic one. yes, we have recorded this and we will share this as well as all the other resources that we mentioned, including links to the folks that we talked about, links to the groups that we mentioned, but also to AARP Resources and others after the call. So be on the lookout for that later this week. And so, I do want to just ask, basically, so some questions that I've seen and I continuously hear from the employers that we talk to is, there's all this conversation around open enrollment, initial enrollment, special enrollment, and there's just a lot of confusion around that. And so, Tricia, I don't know if you could just talk about that again and kind of really clearly lay out, particularly for some of the folks who may be approaching Medicare age while still working, what they should be thinking about.
Yeah, it's a good question. There's a lot of different enrollment periods to think of, and even more so that I didn't cover, special enrollment periods for Medicare prescription Part D, or enrollment periods for Part C, Advantage plans and supplemental plans. But the basic ones to remember is initial enrollment, that's into Medicare's Parts A and B. Initial enrollment, also known as IEP, initial enrollment period centers around the month of the 65th birthday of the person who's going to become eligible for Medicare. So 3 months before that 65th birthday month, the month of their 65th birthday, and then the 3 months after that. That's initial enrollment period. The special enrollment period is for those who have an exempt reason to delay initial enrollment. An exempt reason being you have employer-based coverage and you're going to continue to work for a company that has 20 or more employees, then you are able to delay. Your special enrollment period will be based off when you lose that coverage, and you'll have 8 months to do that. General enrollment is basically if you missed sort of both of those windows with initial and special, and that begins, general enrollment period is going to begin the calendar year, and you do have to realize you're likely to pay a penalty if you enroll during that time. Open enrollment is for those who are already enrolled in Medicare, existing beneficiaries. That's their opportunity to make changes. So if you enroll in Medicare for the first time, don't be afraid that you're going to be locked in to whatever plan you purchased for the rest of your life, because you're not. You have the open enrollment period every year to be able to make changes, adjustments. You're not locked in, and you can kind of go back and forth if you want. There's some, little things to remember to be careful of if you do that, but we encourage everyone during every open enrollment season to review your existing coverage. Your lifestyle may have changed, your health needs may have changed, your prescription drugs may have changed. So it's always a good idea to review your healthcare coverage needs every year regardless. And then open enrollment season is October 15th through December 7th, and that's your time to be able to make those adjustments.
Really helpful, and I think it's a good segue into another question that we got was just reminding folks of when you can incur penalties and what do those look like for the different parts.
Rebecca, do you want to take that on? I'm happy to, but I feel like I've talked a lot. Sure, I'm happy to, and definitely fill in for me any blanks. So late enrollment penalties can be incurred for either the Part B, which is the medical coverage, or the Part D prescription drug coverage at any time that someone is eligible to be enrolled in that but didn't enroll, and also does not have any other coverage that is creditable is the word that is used, but basically for those that are initially eligible for Medicare, for example, would be looking at enrolling in Medicare Part B if they do not have coverage from a large group employer. So those that have coverage with a small group employers would need to consider enrolling in Part B right away when they're first eligible. Otherwise, because Medicare is considered primary in those cases, they would incur a penalty for every month that they were eligible but not enrolled in that Part B or Part D coverage. And so I know Tricia said earlier, it's an important thing to consider because those penalties are then lifetime penalties once you enroll in Medicare. And so it would be an additional cost on their monthly premiums for both B and D if they fall into that category where they were eligible for that coverage and Medicare was primary and they didn't enroll.
We have a question from Gwyneth about the kind of definition of employee when we're talking about the numbers of under 20, and you're considered small, and over 20 you're considered large. And so, there was a question about what is an employee, and so is that part-time versus full-time? And Trish, I know there is some additional information here that you may be able to provide.
Rebecca and Xavier, my colleague, feel free to chime in here. I believe it's 20 full-time, but I would want to triple check on that before I say that for sure. As a definition, those who are receiving benefits, but I will double check and we can get back to that person for sure, unless my colleagues here know the exact answer and are positive about it.
Okay, great. And then we're also seeing some questions kind of related to Social Security and Medicare and how those interact. And Trish, I don't know if you have a perspective on that.
I'm sorry, what's the question?
There's a question between, if you've not taken Social Security by 65, and can you, and how you enroll in Medicare, and so kind of the interaction between the two programs.
So yeah, I mean, Social Security Administration actually administers Medicare, the Medicare program. It's an interesting sort of relationship between CMS and Social Security Administration, which is why the main thing to consider is if you're already collecting your Social Security benefits by the age of 65, then you're automatically enrolled. I still think you should do your due diligence and follow up with the Social Security Administration to make sure you don't have to do anything actively. You will normally get a letter that says, you're enrolled in Medicare, but I think it's always good to sort of be proactive and follow up. Those who are not automatically enrolled, if you're not yet collecting Social Security benefits, you're waiting till full retirement age, or you get your full benefits at whatever age 70, you do have to actively enroll into Medicare, and you would do so by contacting the Social Security Administration in order to actively enroll. And so there's the big difference there, is that sort of automatic enrollment because you're already sort of in the system and collecting benefits, versus if you're not already collecting benefits, then you do have to actively enroll. Either way, I would be proactive and always have things in writing, have your letters that you get from the Social Security Administration or from the employer that says stuff about creditable coverage. Like, those are all good documentation to have on hand that you'll be getting sort of around that time of Medicare enrollment.
I'd like to add, if you don't mind, an emphasis that Medicare eligibility and full retirement coverage eligibility are not related. They are two separate things, even though Social Security manages both. And so it is an area that is often very confusing for folks, because you think you're going through Social Security, everything is at the same time, and it's not. Medicare eligibility is age 65, unless you're someone that falls into the category that's eligible under 65 due to receiving disability. And so it's not related to that full retirement benefit in any way. And it's something that folks need to be aware of so that they don't miss their initial enrollment period for Medicare because of that misunderstanding.
Excellent point. Thank you for that, Rebecca.
And I think we are actually all at time, a pretty good way to end. And I think my final question, Tricia, is what can employers do to kind of continue the conversation, and how can they work with AARP and ACL to better educate their employees?
Keep in touch with us. My email is right there. Feel free to shoot an email if you're interested in a workshop. We have noted those who are interested, indicated the interest via chat, and we'll be happy to work with you there. But take a look at our resources, and please feel free to share them from both of our organizations, the services that SHIP provides and ACL, the resources that we have at AARP. Please point people to them, because I think we've done a lot of research and made sure to hear our the consumers and see what their needs are to make this somewhat easier to navigate, because it can be complex and challenging, but it doesn't always have to be that case. I think it's just a matter of staying informed and helping those make the most informed decision. So again, reminder function and referral function, I think, is your main role, but feel free to lean on us to kind of support and help you with that.
Well, Trisha, Rebecca, thank you so much. Really appreciate the time today. And thank you all for joining us as well. And we did this right on time. So appreciate everyone's time and attention, and hope everyone has a great rest of their week and a wonderful summer. So thank you. And this is now the end of the webinar.